Wonderful, thank you. Okay, welcome everyone to today's Learning and Sharing Café on IYCF programming adaptations in the context of COVID-19. I first would like to introduce myself. My name is Andy Kendall. I'm the Tech RT Program Director, and I am, since I didn't write in the chat box, I am calling today from Spain. Today, we are bringing you this Learning and Sharing Café, slightly different than a webinar in that it's a little bit less formal. It's a sharing experience where we all grab a coffee, a donut if we have one, or a croissant, depending where we're calling in from, and we listen to some different experiences and in a informal environment where we can ask questions and discuss. So welcome everyone, whether it's morning, afternoon, or evening for you, as I do see that we have people calling in from all over the globe. Just a quick scan of the chat box, and we've got people from Vietnam, from Pakistan, Venezuela, Haiti, India, Sierra Leone, Philippines, Nepal, Syria. So we've got quite a good representation. So I welcome all of you and thank you for joining us today. Today's webinar is brought to you by lots of different organizations. It's been a real collaboration that has made it very rich. As I mentioned, I'm from the Technical Rapid Response Team. I'll tell you a little bit more about us in just a minute. And it's brought to you it's been put together by the IFE core group. That's the Infant Feeding and Emergencies core group that you'll hear more about as we go on today. The World Food Program, UNICEF is involved. Save the Children is one of the leading organizations, as well as USAID, Advancing Nutrition. And a lot of these organizations come together to make up what is called the GTAM, the Global Technical Assistance Mechanism for Nutrition. It's a new common platform that's endorsed by the Global Nutrition Cluster to support technical assistance for countries, and that is where we're coming to you from. And the IFE core group is leading one of the global thematic working groups for the GTAM on infant feeding and emergencies. Okay, before we really start, as you may have mentioned, as you may have heard me mention about the recording, we are recording the webinar today. This is so that others who can't join us today have the opportunity to take advantage of the session by viewing the recording later. We will also share the slides and the recording with all of you for your use later, so you don't have to worry, you will get it later, so you don't have to take lots of notes. You can listen intently and participate as you see fit. Today, one of the things I would like to mention is we have a new thing that we started this week. We've got some different options at the bottom. So if you hover down towards the bottom of your screen, you'll see that there's a Q&A section and there's a chat box. I think most of you have now found the chat box to introduce yourselves. Right next to it, there's something that says Q&A. We like to separate out the chats from the questions because we will have a session on Q&A later, and that makes it much easier to be able to pull out what are the questions that are coming in. People can also like a question, which pushes it further to the top to make sure that it's going to get answered. So if you see a question that you have that somebody's already asked, you can put a thumbs up there, and then that will allow it to rise in priority. Great. So with that, let us go on to the next slide, please. So the Technical Rapid Response Team, we have various donors, as you can see on this slide. So FDA through USAID, Irish Aid, Swedish SIDA, Save the Children, and UNICEF. And we thank our donors they've been quite generous in supporting the Technical Rapid Response Team, also known as Tech RT, and therefore we like to thank them in our sessions. But please do note that although they support us, that doesn't mean that they necessarily endorse all of the contents of the webinar. So just so that you know that. Okay, on to the next slide, please. So today's webinar, we are going to cover, we're going to have various different sessions from various different people. I will introduce you to all of them shortly. First, I will be we're doing the introductions. I will tell you about the objectives of the webinar. And then we will go into the background and essential adaptations for IYCF programming in the context of COVID-19. There will be a presentation from the IFE core group on the IYCF programmatic adaptations. Then there will be 2 case studies. In this Learning and Sharing Cafe, we've given a bit more time to the case studies for exactly that reason. It's to share experiences, and that's what we would like to do. So the first case study today is coming to us from Colombia on remote IYCFE support to mothers and caretakers of children. The following case study is coming to us from Somalia, also on IYCFE. That will be followed by a questions and answers session. And then at the end, we have something a little bit different and new, which is an interactive game and quiz. We haven't tried it before, so I'm looking forward to see how it goes. And then following that, we will have our normal, we wrap up, and when you close from the webinar, we will have an evaluation. This one is especially important, and we really urge people to do it. It will automatically open for you as you as you leave the webinar. But in there's some extra questions from the IFE core group that they're wanting to collect some information to be able to see the experience that you've had with the guidance, ops guidance, and some other things. But I think Linda later will be able to tell you a little bit more about that. Okay. On to our next slide, please. So the objectives of today's Learning and Sharing Cafe. We want to create a platform where countries can share their lessons learned and experiences in adapting IYCF programming in the context of COVID. Obviously, everything we do in IYCF and IYCFE, it's involving lots of personal interaction, and therefore it's essential that we're able to adapt our programming to not lose the gains that we've had and to make sure that we are promoting, protecting, and supporting infant and young child feeding. So this is really the key objective. We want to also reflect on how global guidance, including the ops guidance for infant feeding and emergencies, have helped and have been used in inspiring and guiding these adaptations that you've been making. And we want to encourage others to submit ideas for the next World Cafe that we're going to have in October of 2020. So we have this session today, we have another session on the 10th of August, and then we'll start them back up again in October. So we're looking for experiences. If you're interested, please do submit an idea. With that, we go on to the next slide, please. Okay, so now we're going to present all of ourselves that are with us today. Before I go any further, so I've already introduced myself. I'm Andy Kendall. I'm the program director of the Tech RT. We do have behind the scenes a couple of people I wanted to introduce. One is Rita Abiyakar. She's really done all the nuts and bolts of making this webinar happen to make sure that all of it flows smoothly. So big thank you to her. We've also got Geraldine Belloc, who's on with us today, who is supporting with all the chat books and the Q&A side of things. So I wanted to introduce her as well. Now I'm going to hand over to each of our presenters one by one to introduce themselves. So over to you, Linda. And please. Yeah.
Thank you, Andy. Hi, I'm Linda Shaker Berbari. I'm calling from Lebanon. I am an independent consultant. I'm here in my vicinity as an IFE core group facilitator. So I'll be giving the first talk. Happy to be here. And maybe I'll hand over to Andrea.
Thank you, Linda. Hello, my name is Andrea Garcia Charnichart. I am the Nutrition and Food Security Coordinator in Save the Children, Colombia. Adan?
You are on mute, Adan. Could you unmute yourself, please?
Sorry. Hello, good morning, good evening, good afternoon. This is Adan Mahdi from Save the Children Somalia, based in Mogadishu, a nutrition technical specialist, presenting Somalia case study.
Hello, everybody. I'm Brooke Bauer, the IYCF advisor for the Tech RRT. I'm calling in from Abu Dhabi, and I'll be doing your Q&A today. Thanks.
Yeah, hi everyone. Deborah from WFP headquarters Rome, and I'll be stepping in to do the quiz section. Thanks.
Wonderful. Welcome all of our presenters. We are very happy to have you with us today and look forward to hearing everything that you guys have to say. Now I am going, before I hand over to Linda for our first presentation, I wanted to just remind you that if you have questions or questions during the presentations, please do put them in the Q&A box. If you have just general things that you want to say, you can put them in the chat box. And if you're not sure how something's working, feel free to drop a line in the chat box and Geraldine will help you out. With that, I'm going to hand over now to Linda. Thank you.
Thank you, Angie. Thank you so much. So I'm very happy to be here on this Sharing and Learning Cafe. So this part of the cafe is really to present to you some of the guidance and resources that are there that you can use for programmatic adaptations in the context of COVID-19. So if you're implementing IYCF programs, what are some of the tools and guidance that you can resort to in order to adapt your programs for COVID-19. Next, please. So I represent the IFE core group, and if I may just represent, give you an introduction on the IFE core group. The Infant Feeding in Emergencies core group is basically a global collaboration of agencies and individuals. The core group has been active for quite some time, formally since 2004. You can see on the right-hand side the list of members of the IFE core group. It has been coordinated and chaired by the Emergency Nutrition Network since it started. And for the past almost 2 years now, we have been undergoing a small change in the format of the IFE core group, and therefore the group is now guided by a steering committee. On it, there's Save the Children, ACF, CGBI, ENN, and of course, UNICEF. So the aim of the IFE core group really is simply to ensure more effective infant and young child feeding support in emergency context. Normally, the IFE core group does not implement programs, but rather contributes, number one, as a one pillar in developing and disseminating guidance and resource material. So you may recognize some of the material that has been published. And another pillar of the IFE core group is to document lessons learned and challenges and gaps in order to identify those gaps and be able to address them. And a third pillar of the IFE core group is really to raise the profile of infant feeding in emergencies at the global level via advocacy and communication. So all of that in order to ensure more effective IYCF support. As Andy mentioned, since the start of or establishment of the Global Technical Assistance Mechanism, the IFE core group is considered the global thematic working group for infant and young child feeding in emergencies. If you want more information about the IFE core group, you're welcome to visit the page. And then if you're interested in becoming a member, if your organization is not already one, you can also email on the address that is on the slide. So as mentioned, we're here to talk about the existing guidance. And of course, we should first start with the main guidance on infant and young child feeding, which is the operational guidance. And this is, of course, in its third version. This document is developed by the IFE core group and emphasizes really 6 actions within this guidance. And just a reminder, hoping that most of you are familiar with the operational guidance, And if not, encouraging you to really go to the IFE core group page and downloading the guidance. So in terms of the suggested actions within the operational guidance, the first of which is to endorse and develop policies related to infant and young child feeding. The second is the importance of training staff and building their capacity to be able to respond. Third, coordinating operations amongst actors. Fourth is assessing and monitoring. And then fifth, protecting, promoting, and supporting optimal infant and young child feeding with an integrated multi-sectoral approach. And then sixth is the minimizing the risk of artificial feeding. Now, the operational guidance at the new version also includes a large box, which has mainly actions or suggested actions for emergency preparedness. Now, the question is, in the context of COVID-19, is this operational guidance still valid? And the answer, please, Rita, if you can do next, just to confirm that this operational guidance really still applies in the context of COVID-19, and that this is a guidance that would guide you for the implementation of infant and young child feeding in emergencies. So in terms of, this is the first guidance that I would like to highlight first. Now, if we want to zoom in onto COVID-19, yes, please, next, please. And allow me just to give you a bit of background of, around how things have evolved and what are some of the guidance that have been developed. So back in February 2020, an exercise was conducted in terms of compiling questions, next please, Rita, questions and issues related to infant and young child feeding in the context of COVID-19. So this sort of exercise was mainly to understand what are the issues, what are the challenges that countries are facing and programmers are facing in terms of COVID-19 and IYCFE. And this was started also within the IFE core group, but also outside and within different platforms. The exercise was also stemmed to having a sort of a summary of issues and challenges that was done by Professor Mia Ververs, who compiled these issues and summarized them. And most of the questions really revolved around, so what are the issues related to transmission? What about transmission and breast milk and breastfeeding? What about, what are some of the recommendations for programmers? What are some of the recommendations related to providing technical assistance within IYCF programming? And what about donor milk? What about artificial feeding? And so all of these inquiries, including a main one, which is what are the precautions that need to be taken in the context of COVID-19? And of course, there were concerns about misinformation and the importance of ensuring that the information that is provided is evidence-based. So fast forward within the year, and as a result of the leadership of, next please, Rita, as a result of the leadership of UNICEF and the Global Nutrition Cluster and the Global Technical Assistance Mechanism, this brief was issued, which is the first brief on infant and young child feeding in the context of COVID-19. And basically this brief is a consolidation of recommendations and on infant and young child feeding in the context of COVID-19. And it is based on the operational guidance, but also on the guidance from WHO on caring for patients with COVID-19. So it really summarizes and emphasizes that within the context of COVID-19, mothers with suspected or confirmed COVID-19 should be advised to continue to breastfeed. So it is re-emphasizing this recommendation, but also providing some considerations for programming in the context of COVID-19. We had a webinar back in April introducing this brief, and so I encourage you to go back and see that if you haven't done so. It gives details on the content of this brief, and you can also find it online. Next, please. So as we moved forward, questions, even after issuing this brief, questions continued to arise from the field. At the same time, led by UNICEF, a multi-agency stakeholder meetings were conducted on a weekly basis first, and then currently they're on a monthly basis. So during these meetings, issues related to infant and young child feeding in the context of COVID were raised, and accordingly, it was clear that there is a need for more guidance on how to adapt programs for the context of COVID-19. And therefore, a team was created called the Programmatic Adaptation Team. We call ourselves PAT. And members of the PAT team included UNICEF, IFE Core Group, Tech RT, WFP, and Save the Children. And basically, this group was tasked to develop and update a Google Doc, which would include resources for the adaptations of IYCF programs. You can access this live Google Doc by going either to the GNC website or to the GTAM website by clicking on the programmatic adaptation support and then clicking on the guidance. You can see that blue little link there, Nutrition for Infants and Young Children. And when you click on that, you will reach that live document. And that live document is meant to provide some practical guidance. Next, please. So yes, this is the link. So just to zoom in a little bit on this Google Doc, it is divided into 3 columns. The first of which is what are some of the anticipated disruptions and challenges? What are some of the suggested alternative approaches? And what are some of the relevant resources and tools? And as it stands at the moment, this document is divided into 3 main sections, one focusing on delivery of services, the other on norms and fears, and the last is on communication. So I'll spend just a few minutes now on to give you a few examples on how you can use this tool. Next, please. For example, yes. So at the beginning, on the beginning of this document, you can see the section on delivery of services, and you can see the 3 columns. So for example, in the context of COVID-19, we are faced with the challenge of mobility restrictions, of the inability to, for example, conduct gatherings or meetings, etc. So therefore, the second column provides you with some alternative approaches, for example, use of radio, use of the phone counseling, and hopefully now in the case study, we will also learn how our colleagues have done that. And then the last column provides you with links and resources that you can click on to actually use more detailed information. And so these resources, the first of which, as you can see, is the IYCF brief that you can click on, but then the others are resources that may not be specific to IYCF, but they also may apply to IYCF. So I'll give you an example. So that last bullet, next please, Rita. An example of, yeah, sorry, it's okay. So that last resource is the interim guidance from IFRC, WHO, and UNICEF on community-based healthcare for outreach and campaigns, etc., in the context of COVID-19. So this resource was included in the as a resource in the Google Doc because it has information that can be relevant to the IYCF interventions. For example, suggesting to provide virtual support to pregnant women. And then you have a small table that provides you, if you're doing these activities, what are some of the type of precautions that you can take, and what are some of the personal protective equipments that you need to have. And then examples of, let's say, a social distancing for group meetings. So this is an example. Another example that I will quickly go through is around the uncontrolled donations of BMS. Next, please, Rita. So, for example, a challenge also is the uncontrolled donation. No, sorry, back. The uncontrolled donation of BMS. So the alternative approaches normally are not specific to, okay, something happened. Yes, thank you. Are not specific to COVID-19, but then you can see under the relevant resources and tools, you can find, for example, this template about the joint statement. So if you can, next please, Rita. So if you click on this, you have a resource that you can use. If you are faced with the uncontrolled donations of breast milk substitutes, then this resource can be used as a template in order to issue a joint statement that is specific to IYCF in the context of COVID-19. Then my last example is really on the communication. Next, please. Next. Thank you. So the last bit of the Google Doc is around communication training tools and resources. Again, what are the challenges, the approaches and resources? So what I wanted to emphasize here is that most of the challenges that and sort of issues that were communicated were around what are some of the key messages that should be disseminated via the different platforms, the online platforms, etc. So that is why on the right-hand side, you can see really a list of resources and tools, which on the next slide, I just included this basically, next please, yes. I just included this just as a reminder of the different educational tools. However, I'm encouraging you to be part of the 10th of August Café, where these tools will actually be presented and discussed. So I've included really the first, on the left-hand side, you can see the first tools that were developed by WHO emphasizing that women with COVID-19 can breastfeed and encouraging the support of women to breastfeed during the context of COVID-19. And then you have in the middle the counseling guidance that have been adapted to the context of COVID-19, and others on the right-hand side, such as different films and movie videos that can be used. So all of these, the links are included in that Google Doc. Next, please. So, no, sorry, just stop. back, yes. So, yeah, thank you. So what we've done at the moment is really present to you that the operational guidance is really the basis of guidance for infant and young child feeding. We've presented to you the IYCF e-brief, which is the first sort of guidance on COVID-19, and then the Google Doc, which is the active document that will be updated on a regular basis. That would include a compilation of resources that you can use, and hopefully that you've used, for the adaptation of your programs. Now, of course, the important part, as Andy has mentioned, is, next please, Rita, is whether and how we have been using these tools and how useful these tools are. And of course, one of the main components, or one of the main an important points, is to be able to actually learn from each other. Next, please. To be able to learn from each other and really understand how we are using these resources and how we're adapting to this context. And therefore, next please, Rita. And therefore, it's really important to share our experiences. So I'm including here the link, and next please, and just the format of a form that you can actually use if you would like to share how you have adapted your programs, how have you changed your programs in order to fit into the context of COVID-19. So really encourage you to do that, and really looking forward to listening to our colleagues on how they actually implemented and have done the adaptation. So thank you.
Wonderful. Thank you so much, Linda. I think everyone, you've done a great summary of kind of where we've come and where we are now and what we're looking for. So that's super. With that, now we'll hand over to Andrea Garcia Charnichart from Save the Children Colombia to tell us about the experiences that they have had. Looking forward to it. Thanks. Over to you,
Thank you,
Andrea.
Thank you. Well, hello to everybody. Good morning. My name is Andrea. Thank you for your time. I am going to present our adaptation of nutrition activities in times of COVID-19 in Colombia, South America. Next, please. Well, a little context. Our intervention is in 4 regions of Colombia. It's La Guajira, Arauca, Valle del Cauca, y Bogotá. Due to the Venezuelan migration crisis, this humanitarian context started in 2015 because the rapidly deteriorating economic and political situation in Venezuela. Today, I am going to focus on the nutrition component, but we work hand in hand with CASH as CASH plus nutrition intervention. Actually, 1.8 million Venezuelans lives in Colombia, more than a half in an irregular situation, and only the 12% have access to the health system. In March 2020, because of COVID-19, many activities in primary health were interrupted. In Colombia, the Growth and Development Control is the via for identification of malnutrition and is stopped. In Save the Children, until October 2019, we have reached with cash plus nutrition activities 13,183 individuals, of whom 21.9% were children under 5, 11.6% children under 2 years, and 10.5% were pregnant or lactating women. Next, please. In Colombia, we have an exclusive breastfeeding rate of 36.1%, and in the baseline of our first project, we found 23.33%. There is no national data of minimum dietary diversity, but in baseline, we found only the 12.38%. The consumption of fruits and vegetables is in 14.85%, and national data reports that the minimum acceptable diet is in 41%. In other hand, IFAN reports 55.3% of bowl feeding. Next, please. With this data, before COVID, the nutrition team was working on social behavior change activities like support groups, individual counseling, sensitizations on IYCF, workshops, establishment of breastfeeding corners, and we were starting with nutritional screening. Next, please. Thank you, sorry. Well, then in March 2020, the COVID-19 prevention measures were implemented in the country, and we had mobility restrictions that we still have at country level. Although as humanitarian workers, we can ask permission to mobilize, our possible beneficiaries cannot, and it would be risky to quote them, especially in urban settings such as Bogota and Cali. Next, please. And yes, so we make adaptations to some nutrition activities, trying not to lose our possible beneficiaries, taking advantage of the resources that we already have, such as cell phones, databases from cash component, and of course the IYCF team. We started calling all the cash beneficiaries, promoting breastfeeding, and informing about the prevention of COVID-19 without focusing pregnant or lactating women or children under 5. Basically, because at the beginning, we thought that we were going to be able to return to the field soon, but that didn't happen. And in May, we make adaptation to our standard operation procedures, the monitoring tool, and reinforce the informatic and communication skills to give a better response by phone. Next, please. The changes in the procedures, we had a standardization of our activities in the field. So by changing the attention mode, we designed a script that serves as guide to take the first call we make. The dialogue is carried out according to the classification of the women or the family we are calling. We have 3 classifications. It's pregnant, is where they have children under 6 months, and under 6 to 23 months. And we also started applying a satisfaction survey, also by phone. In the monitoring, we added questions in the monitoring tool. For example, we are registering whether people are interested in receiving more calls or not. An important note is that this tool keeps improving. For example, last week, thanks to the advice of Alex Yelamo, we readjusted again just because we want to learn more about the woman we are talking with. For example, we have now the disaggregation of pregnant, of breastfeeding, or non-lactating women with children under 2 years old. And finally, in the reinforce, we were making the calls at the beginning in a very mechanical way without looking for people to express themselves. So we reinforced the counseling skills found in the WHO manual to make it better. Next, please. That's how we are now delivering remote IYCF e-support by phone through at least 3 phone calls, not video calls. They are phone calls. The first call is the call for promotion and engagement with the classification I mentioned before. A second one, if the counselor detects specialized help needed, or if the woman or man ask for it. And the third and fourth for support groups, where we call a maximum of 4 people who share something in common that we already know because we made the classification in the first call. In field, we continue seeking partnerships to establish breastfeeding corners. All is done by phone or video calls. And unfortunately, we had to stop with the nutritional screening. Next, please. I can't see the next, but I am going to keep talking. Well, the next slide is about some results in numbers. Since May 14, with 8 members of counseling staff calling full-time, we have reached 3,897 calls, of which 2,267 were promotion calls and 1,157 support groups. For individual counselings, we have 422. A total of 3,321 women attended, of which 1,861 are lactating and 362 are pregnant.
Apologies, Andrea. Just to let everyone know, we have the person who has been sharing their screen had their laptop crashed. So we shall have the presentation back up shortly. And if Andrea, you can continue in the meantime, that would be all right. Thank you.
Okay. I'm gonna keep talking. So, well, I am going to talk to you about the challenges we had. The first one is that we are working in Guajira, a territory that has a majority of indigenous population. So the conversation is difficult with them because they are not used to the phone. And obviously an important one is that not everybody has access to a phone. It's the next. Thank you. And in the support, we have found that all the nutrition staff was hired from the beginning with the communication skills for counseling. They are also trained on IYCF-E and can solve almost any problem related to IYCF practices. And the team is always in communication. Everybody knows when we must make changes and apply them. Next, please. To summarize, our enablers for this adaptation are that we have coordination and communication between the 4 regions and obviously with the CASH team. We already had cell phones and computers. Our program manager of Cash Plus Nutrition trusted in our proposal and present the changes of the activities to the donor for approval. And we have the budget available to keep going, at least with the staff. Next, please. In the lessons learned, well, as I said to you before, we are applying satisfaction surveys, and from 161 surveys, the 54% were very satisfied, 42% satisfied, and 4% unsatisfied of receiving this kind of intervention by phone. Next, the communication skills proposed in the WHO counseling manual are our basic tool to make a link with people. That's what we want. The third one is that we can not only give information by phone, we learn to use the phone call as a tool of exchange of information and participation. The next one is that we need to prove that this kind of intervention, like in a remote weight function, and has impact. It has advantages, for example, in saving money of transport and material and time for logistics. We only need the trained staff, the internet connection, and the computers. Here, it's important to say that we should be connected with other organizations or components to receive the reference. For example, in our case with cash, or for example, in Arauca, we have an agreement of reference from the local hospital. All the postpartum women are referred to receive our intervention. And the last one is that we should think how we are going to break the cultural barriers, because communication by phone functions better in urban context and the access to a phone too. And that's all. Thank you. And did you have your microphone off?
Thank you. Thank you so much, Andrea. It was super interesting presentation. For me, the crux of an adaptation that is as simple as using a telephone is quite incredible. So I'm so happy to see us using things that are so obvious, but maybe so not obvious at the same time. So thank you for sharing that with us. I also now we're going to be going on to our next case study, which is Somalia. But before I hand over, I want to mention that I see that people are being very shy today. Very few questions or discussion. Questions are limited and the chat box is quiet. So please, I encourage you all to let go of your shyness. And if you have anything coming to your mind that you would like to ask, I'm sure other people are thinking similar things. So please do write them out there. If you've got comments or questions, please go for it. On that note, I'm going to now hand over to Adan Mahdi, who will just take us through the case study from Somalia. And over to you, Adan.
Thank you very much, Andy. Hello, everyone. This is Adan Mahdi. Just which I want to share with you the IYCF in emergency in the context of COVID-19 in Somalia, which we have taken a special case for one project that works throughout Somalia. Next slide, please. Yeah, this is one project which is an integrated emergency life-saving project, health, wash, nutrition, livelihoods. Throughout, I think we have left one slide before. Can you go back to one slide before? Go back. Go. Okay. This is sorry. So this project is integrated programming, which is funded by one donor, and you can understand here that the logo of the one donor is one. Somalia is composed of 18 regions. Out of that 18, 9 of those regions is working this project, while the Save the Children logo is also indicating the offices throughout the country that we have. So Somaliland is among one of the top 10 countries with the highest prevalence of malnutrition in the world. And again, Somalia population is currently experiencing multiple shocks desert locust that has invaded throughout the East African, particularly Somalia, heavy rain and flash floods from that has also caused by the climate change and the coronavirus pandemic, as well as one of the chronic, which is protracted conflict between Somali National Army, backed by AMISOM, versus Al-Shabaab. Go next slide, please. So this project is targeting 1 million people, 1,960,072 total. All of those 1,096. The project has started December 2019 and is going to end November 2020. Therefore, now in the first 6 months, we have reached 515,166 persons through different IYCF sessions, group sessions, promotion sessions, as well as individual sessions. It was pre-COVID-19. Out of those 515, 74,542 were men. This is this graph as well indicating the target of the age group, 0 to 6 months, target and reach 6 to 59 months, 5 to 18 years, and over 18 years. So each will indicates that the number of target as well as the number of reach that we have reached during the 6 months period of the project has been working. Go next slide, please. Yes, this slide also is indicating the IYCF data before the COVID-19, as we have some data, while others there is no, some indicators we do not have those. Initiation rate is with 1 hour, it is 80% around, which is indicated by the latest FSNU IYCN information, which a study that has been conducted in 2016. The exclusive breastfeeding countrywide average is 34%. Minimum dietary diversity, it is 15%. Minimum acceptable diet from 6 to 20 months is also 9%. And consumption of vegetables and fruits, it is 48%. Those data has been received, but others we could not get since it has been. This is also indicating that before COVID-19, what we have been doing, our programming, as you can understand here, it is community-based IYCF support groups, as well as food micronutrient or food demonstration session in one of the IYCF sessions at the health center or the nutrition center, and also IYCF sessions in the community, in the gardens, and one of the promotion sessions in one of the educational institutions that was being conducted during before. Go next slide, please. Next slide. Yeah, this. So since COVID-19 has come, all normal business were disturbed. Therefore, we have adapted, we have increased our efforts, and as well as continue life saving. As you can understand here, social distancing is applied, as well as IYCF community based, we're also continuing without stopping it. We have distributed masks and to the beneficiaries, support group, further support groups in the community. Again, we have increased the number of hand washing facilities inside the center as well as outside, and also individual counseling where to continue because of the it should be continued. It is one of the life saving. That was one of the adaptations that we have done. The other thing that disruption has done is disturbance of feeding practice. Can you go back one minute? Yeah, disturbance of feeding practice, as well as reduced diaspora remittance. Somalia, particularly, most of the Somalis are dependent on their relatives on the diaspora, so diaspora remittance has been reduced. Food prices has been increased, reducing therefore all these minimum meal frequency has reduced. That was, and gradually the burden of malnutrition has also increased. Go next slide, please. Still, it is we are in adaptation. We have strengthening IYCFE and enforced its implementation. Trained more than 520 IYCF counselors and adapted COVID-19 messages, as well as we have distributed PPE, face masks, hand sanitizers, as well as we have increased hand washing facilities. We have printing IAC materials of COVID-19, including IYCFE counseling cards, as well as we have reduced the number of mother-to-mother support or father-to-father support groups. From previously, we have been forming 10 people per support. Now we are doing only maximum 5 people, as you can see the photos from the father support groups as well as mother support groups. And again, in the MBA, only we have 4 people. One is the facilitator, and one is the third. The rest are the attendants or support groups. And again, we have also conducted the open area individual counseling in order at least to minimize the risks of COVID-19 and implement IBC, infection prevention and control mechanism. Go. Yeah, we have sometimes we have challenges as well as enablers. We are the challenges in the first starting was the funding gap, since we did not anticipate that COVID-19 will come. Therefore, we are lack of PPE, so we have that has increased our concern of most vulnerable communities. More people being food insecure due to increased unemployment rate. Number of mother support and father support group were reduced. Health and nutrition promotion sessions were stopped, and also on job training and support supervision were reduced greatly. And all coordination meetings has been changed to virtual, while some majority of people who could not attend that because of the connectivity. That was the challenges. But we have also enablers, management support. We have received management support and advocacy in order to respond. Cooperation and support of families, mothers, communities, as well as health workers. Donation from maybe PPE materials or equipment from UN agencies, especially WFP supply PPE, face masks. Nutrition cluster delivered different trainings, CMAM, IYCF, community health workers for COVID-19 in order to increase the capacity of frontline staff and respond to COVID-19. And all policies and guidelines indicated that breastfeeding also can be continued. Never were stopped by IYCF or breastfeeding. Religious and cultural leaders have also contributed to increase awareness on COVID-19 preparation, adaptation, and response. That has also encouraged all communities to practice infection prevention and control measures that health practitioners provide. Go back, next slide, please. Okay, what do we learn from this? And we have learned from this project integration of the nutrition with sectors such as wash, health, food security is possible and can achieve great results, as we have seen. Life-saving interventions can be continued during COVID-19 pandemic. Applying COVID-19 key messages of increasing sanitation and social distancing has reduced the spread of disease. Collaboration have worked well with cluster during trainings, religious leaders and other partners doing awareness raising. The way forward that we are anticipating is more people to be recruited from a community to increase IYCF uptake and SBC messages, social behavioral changing message. Continue funds to deliver community-based IYCF. And also we need to increase advocacy to strengthen recommended IYCF in the community from the policy level and advocates at policy level, so that the breast milk substitute, code of conduct, and IYCF are streamlined in all thematic and sectorial responses during and after COVID-19. scale up mother-baby areas to improve the uptake of optimal IYCF in different levels of the communities. I think this is the final one. Thank you very much and welcome any comments, contribution, as well as comment. Thank you. Over to.
Thank you so much, Adan. It's very interesting to see the experiences in Somalia where you've been able to adapt but still have face-to-face interaction with the people that you're working with in the communities. It's really interesting to see. Thanks so much for your presentation. Now we are going to go on to our Q&A session. And for that, I'm going to hand over to Brooke Bauer, the Security IYCFE advisor, to facilitate that. Over to you, Brooke, and I will also ask all the people presenting today to put on their videos so that everyone can answer on the Zoom. Thank you.
Thanks, Andy. And thanks to everybody who had some questions into the chat box. We were answering some of them throughout the presentations, but we'll go ahead and go through some of them that Andrea and Adan can address. Andrea and Adan, there were a couple of questions regarding breastfeeding counseling over mobile phones and the practicalities of that. How did your programs work with, maybe Andrea, you can answer it first. Virtually, how did your programs do the breastfeeding counseling with regards to latch and positioning and so on?
Okay, well, yes, it can be difficult. We have developed some graphic pieces to share with people in case they need like an image to get better. But these have complications, basically because not all people have a smartphone. A lot of people only have a cell phone, like the little ones that only receive calls. So that's why we need to communicate with people with this technique that the WHO tell us we should. So we can make like real link with people and try to understand. It's difficult, I know. Obviously, you cannot compare being face to face and watching what is happening, but we are trying to use like these abilities, these skills to give the support. Of course, if there is someone who have a smartphone, or if this family decides that they need to see us, for example, in Bogota happens, we have one case where the family get a smartphone so we can make a video call. But for example, in La Guajira, that could not happen so easily. So that's it.
Thank you. And just a quick follow-up question. Also, that was also asked, how do you, or have you been able to reach out to pregnant and lactating women or families that may not have cell phones? Were you able to bridge that?
Yeah, that's fail for us because we cannot reach them. We are working basically with the databases of reference of the hospital or CASH or other organizations, and we need the phone right now.
And with regards to, another question for you, with regards to your conference call mode with the support groups, how long do those calls generally last? What's the duration of those calls?
Okay, it depends because some groups are like really participating and they want to talk everybody, but in some groups the monitor, that is Save the Children staff, have to push a little more to with making questions. So it depends, and it can last from 20 minutes to 40 minutes.
Yeah, thank you. And this question is for Adan. Which is I find it to be a quite important question. Adan, how do you maintain privacy in counseling sessions in an open space in Somalia?
Of course, it is not because individual counseling always needs privacy, and you can understand that COVID-19 and social distancing at this moment is still, if you can see the photo, it still is privacy because it is a very large area that no one is near them, so they have their own their own conversation in that open area, though there is no fencing, but still they are applying the privacy because individual counseling should be held in a privacy. That is one of the adaptations in COVID-19. But previously or before, all the individual counseling should be held in a private specific area that should be allocated in the MBA as well as IYCF corner in the health centers and the community-based IYCF. That is the approach that we have been adopting.
Great, thanks. And a follow-up question, when you were conducting the trainings, how were they conducted? Were they remote or face-to-face? And if they were remote, what can you expand a little bit on that experience?
Yeah, the training has been leveled as one of the frontline staff or staffs that has been allocated to be trained. They should have Zoom, go to Zoom because of, as they are staff, they are paid. They can at least go to somewhere and they can attend the training. In order to attend the training, they will have majority of the cell phones or the of the majority of the staff. They have smartphones, so it is easy for them to attend that training through their own phone. That was one of the approach. The other one for the community health workers, the trainings that has been allocated. We have been doing the minimum persons that can attend that training with keeping all the all COVID-19 messages, keeping applying social distancing, IBC measures, everything should be in place, and there they should have to attend and understand the COVID-19 messages in that training with a very minimal people, as well as applying social distancing that has been enabled us to give them gradually the training for the community health workers. But the rest of the technical staff, they can go to virtual training.
Great, thank you. And another question, with your adaptations, did you see a difference between rural and urban settings?
Of course, yes. In the rural and the urban settings, they are totally different, as you can understand. The rural settings, people are mostly attending the sessions as they have very open area, the bigger areas that with a very good ventilation. But in the urban settings, it is the meetings should be minimal, very minimal, because of the density as well as overcrowdedness. We need to avoid overcrowding. At the same time, we need to continue life saving and capacity building. That is the difference.
Great, thank you. And this question's both for Andrea and Adan, I would imagine. In both of your field experience, in both of your experiences over the past few months, have you seen a better or increased practice in breastfeeding in your contexts for COVID-19? And I think, Andrea, you addressed that a little bit in your presentation.
Well, we do not have like the national data, but we are making a baseline and endline. And well, in Colombia, there is always like a low rate. What we are talking with women, they are worried about the COVID and they don't know if they should keep breastfeeding or not. But certainly making the phone call and giving them the confidence that we are giving the right information helps. I can give you like the exact data, but it definitely gives something more to women for the pregnant and for the lactating one.
Yeah, for Somalia, we are trying our best to at least collect the information regarding that, because we are doing now, though the report is not finalized, the baseline of this project throughout the country, that we also wanted to know exactly the rate of the breastfeeding. So on the other hand, you see that food insecurity has increased, unemployment has increased, the meal frequency has is reduced. So the panic for the mother also is increased due to food insecurity, as the mother might be urban and poor people, mostly IDPs, are only getting once or twice, very small twice per meal. So we cannot say it's increased or decreased, but we want to at least get that information from the baseline. But hopefully that even the malnutrition rate is going to increase, is increased almost. So we can say minimally maybe IYCF also disruption. There was a disruption of breastfeeding because of those contributing factors, that mother could not be encouraged to continue, because the mother can feel hungry. She's so frustrated. She's so stressful. She has a lot of children. So sometimes she go to as a breadwinner. That all those contributing factors are there.
Thank you. And a couple questions for Linda regarding BMS, breast milk substitute. Have we seen an influx of BMS during COVID? And have we seen a change in breastfeeding patterns globally that you've come across with your work with IFE?
Thanks, Brooke. So I guess also we need to discuss the issue of the influx of BMS, and this is being documented, and the latest report on the code really highlights how there is really an increase in the marketing and the donation of BMS. So what I would say is it's really important to go back to the basics of the importance of having a policy within the country, within our organizations, that would ensure that we are abiding by the code, and also to encourage the issuing of the joint statement in order to make sure that we are protecting infants and young children. I saw the question also, which was referring to the problem of sometimes mothers preferring not to breastfeed, and that whether this has an impact on BMS donations, and so really these are two separate things in a sense that as an organization and within a country, we need to work towards protecting breastfeeding by ensuring that the marketing is regulated, that there are no donations. So there are a lot of lessons learned from different emergencies to apply here, even in COVID. And at the same time, in terms of mothers not wanting to breastfeed, I don't have any data on that. On the contrary, there was a paper that was out in Australia showing that mothers in the context of COVID-19 were looking at increasing their breastfeeding and relactating because of the benefits of breastfeeding. So another point is also for healthcare providers to really have their internal policy that is abiding by the WHO, which is to encourage mothers to feed their infants as per the recommendations, while having the hygiene precautions. Over.
Great. Thank you. And I think this question goes possibly to all three panelists. Do you see that IYCFE programs will be changed as a result, permanently changed, or recommendations permanently changed as a result of some of the adaptations that have been implemented in COVID? Do we see that these adaptations and recommendations will continue long into the future?
Maybe I can briefly take this and then give the floor to colleagues who maybe can give also more on that. But I think that is why it's important to share those experiences and to see what is happening in the program. The important thing is to continue with the support of infant and young child feeding. I think there was a lot of talk about the impact of the pandemic on the support of infants and young children in terms of their nutrition needs. So we're afraid of this impact that it's having. So at the same time, we need to really learn from this experience so that we can adapt our programs. I don't have an answer in terms of whether these will continue to be as such. I think a lot of our programs are adapting as we speak, and it probably will take some time for us to go back to the normal, but maybe Andrea or Adan would like to give
Yes,
some input.
I would like to say that maybe in the future we can think in both, because, for example, we are reaching a lot of more people than we could do in the field. So it's really interesting how we can take these women from, for example, all the hospitals, give them some information, and if they need next, we maybe can arrange an appointment or another kind of intervention. But I think that it would be great if we can make both. I think that we can reach more people if we make this.
Great, thank you.
Yeah, for us, our target is to integrate all the programs that we are undertaking: health, wash, nutrition, even protection, even education. Sometimes we have a school and nutrition programs. All those programs we streamline with IYCF in order to increase at least the optimal IYCF key messages, and to disseminate as well as convoy all the populations. One of our recommendations was maybe to increase the uptake of IYCF to the different levels, the community as well as in the very remote areas, because it will have a positive impact if we increase the IYCF package to the remotest areas. Because otherwise, it will have been very difficult for us to prevent them under nutrition as well as uptake and increase the uptake of IYCF. That was our aim as well.
Thank you. And there's a couple of questions regarding maternal nutrition and pregnant women and birth weight. So given the question was asked for both contexts, for both countries, is there data on maternal nutrition status? And given the number of pregnant women, is there data available on birth weight changes since COVID restrictions were implemented?
In Colombia, not already.
Adan, have you noticed, or do you have any data on maternal nutrition status and changes during COVID? Changes on birth weight?
Really not, we don't have, but maybe when we finish this baseline, maybe we will have data, because this project aim is, the first target is 1,000 days mothers, children under 2, under 5, pregnant and lactating women. That's hierarchically, it is targeted. So maybe we can get that, all those information for when the report is out.
Yep.
But now I don't.
Great, thank you very much. And with Andrea, with your outreach, what communication means did you use to contact individuals? Were you using WhatsApp, SMS, and were you using different languages throughout those communications?
Well, at the beginning, only Spanish, but we have in Guajira a member of our staff that speaks Wayunaiki, that is the indigenous language of there. But as I said, these populations are not used to the phone, so it's really difficult trying to do it first in Spanish and then in Wayunaiki. So I would not say that it's like the better option. Talking about WhatsApp, well, we know that not all people have access to this. And if they have, we don't know if they have data like internet to use our resources. And the other, like it's an important part, is that if we send information, of course, they can give us information. And in Save the Children is super important, the child safeguarding. So it's complicated to make this link just like in all the phones of the staff. So we are working, trying to find the right channel to use these kind of tools like WhatsApp, because it's delicate. And the SMS, yes, we are working on that. We want to use them as a reinforce to the people that already told us, that gave us authorizations to send them more information, because we also are respectful with that. If people doesn't want to hear more from us, we are going to respect it. So that's why in the first call we ask them if they want to be with us.
Great, thank you. And final question, Andrea, for you. Did you use or did you look into using integrated voice messaging for implementing IYCF through these phone calls?
Not really. I have not thought about it, but we can explore. Thank you.
Okay, thank you very much to all the panelists for answering the questions. I will put, for any questions that do come up from the attendees, I will put some links within the chat box where you can answer questions on, for example, the ENN forum, and for the GNC help desk where you can get additional answers for some and support for your needs. So thank you. Over to you, Andy.
Well, thank you so much, Brooke. Okay, just to go one step further with what Brooke has just said about any unanswered questions, we will compile the questions that were asked. If your question hasn't been answered, we will make sure that afterwards we pull the questions together so that we can share the answers with everyone. And if there's something that still remains unanswered, then it will go to the GTWG, the Global Thematic Working Group on Infant Feeding and Emergencies, with the GTAM. With that, I am going to hand over now to Deborah, where we are going to have a little quiz to see, interactive game quiz to see what we've all learned today. So please stay with us, and over to you, Deborah.
Yeah, hi everyone. Hi everyone. If you've got a smartphone, could you please grab it, get it very quickly? And we're going to do a quiz through what's called Mentimeter. So if you could quickly make sure that you've got your smartphone near you and go into a website. It's coming up on the screen now. It's called www.mentimeter.com. Now it should be coming up in your view now.
It has just been posted in the chat box, actually.
Okay. Are you able to see it on the screen now? So www.menti.com, and it will ask you for a code, and there's a code there called 739193. So where it asks you for the code, if you'd put that code in. Great, everyone's arriving. Okay, so yeah, how many? So if you'd answer the question, are the IFE operational guidance recommendations also applicable to COVID-19 pandemic? This will test how well you've been listening through this webinar. Man, you've been listening really well. Any other answers? We've only got 17 answers. If you put in the chat box, do you need longer time to be getting your mobiles?
Yes, I think so, because now in Mentimeter it says you didn't vote in time, so the voting is closed.
Okay, okay, we'll go back. Sorry. Yeah, it kind of had a time limited on this, so. Okay, it looks like we'll have to go to the next one. Sorry, everyone. So, the second question, is it recommended that a mother infected with COVID-19 continue to breastfeed her baby? Yeah, sorry, somehow the time has been set really, really short. Okay, so everyone's like perfect within question 1 and 2. Here's question 3 coming up. In Colombia, is Save the Children implementing IYCF face-to-face counselling as part of COVID-19 response? Yeah, you guys are doing really, really well. Amazing, great. Yeah, they're using the phone there. So, and this is the very last question now. Is the experience from Somalia showing that mother support group meetings can be continued by ensuring recommended hand wash? Brilliant. You guys have really listened well, and apologies. Clearly the time allowed for replying, you had to be really smart, quick. So thank you very much indeed. Yeah, excellent.
Thank you so much for that, Deborah. I hope everyone enjoyed that. Obviously, we also have a little bit of learning to do. This is the first time we've used the quiz function on one of our events, and I think that we know now that we need to set the time a little bit longer for answering questions, but it's nice to see that everyone has done really, really well. With that, we are coming to the time of wrapping up our cafe. It's going to be time for us to go. And so I want to just give you a few little final words. One, maybe you're looking to see how you can get some support. There's a lot of different support that's available through the Global Technical Assistance Mechanism for Nutrition. If you are looking for remote support or in-country technical support, it is available through either the TechRT or through other GTAM partners. If that's one option. If you're looking to hire a consultant directly, there are a series of 5 different consultant rosters that you can access by getting in touch with the GTAM. Also, if you have just quick questions that you want to ask, please also get in touch. You can reach the GNC help desks through the GTAM as well. So in all cases, if you can contact the GTAM through the link that's provided there, perhaps somebody can paste that into the chat box as well, so people can check out the website. There in that website, you'll see a request support button, and you fill out a few questions and then somebody will get back to you. It's really quite simple. So please do reach out if you have any of those needs. On to the next slide, please. Okay, I want to make sure that everyone knows about the next Learning and Sharing Cafe that we have coming up on, I believe that's Monday the 10th, although it says Tuesday the 10th. Yes, it is Monday the 10th of August. So please do join us for our next Learning Cafe if you've enjoyed today's. At the same time, same place, more or less. Please do join us. Thank you. And over to the next slide. So we do have one last step, and that's asking you to take to go ahead to the link that's the webinar evaluation that will pop up as soon as you close out of here. The important thing today, it's even more important than normal, is because we have some questions that we'd like to see how you guys have been using the IFE operational guidance and some other questions. So we really do urge all of you, if you can, to go ahead and take a few minutes to fill in those questions. Also, it gives us some feedback on how we did on the webinar, on the session today, Learning Sharing Cafe. And if you have any ideas for some new ones, then that would be great. I also wanted just to mention, as Linda had talked about, there is a form that you can fill in if you have some ideas for some experiences that you would like to share. And if somebody can paste that link to that document in the chat box too, that would be great, so people can share their experiences on the next sessions that we will have in October. Also, there's the document for pragmatic adaptations. If you would like to see that again, it is available in there. We will be sharing the slides and the presentations and the questions in the coming week to your emails. They will also be on the TechRT websites, so please look out for them. And otherwise, I just want to thank everyone very much for joining us today, and to thank all of our presenters, in particular from the IFE core group, from Save the Children Colombia, Save the Children Somalia, from WFP, from UNICEF, the GTAM in general, but a special thanks also to Save the Children UK for Alessandro Ialemo, who's not with us today, but is with us in spirit, who has been the one really pushing forward this whole series. So thank you very much, and I'm wishing all of you a very nice day, afternoon, evening, depending where you are, and looking forward to see you again next time. Thanks a lot.